Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you can be with us on today's program. I've got with me Dr. Shailendra Sugrim, Head of Department of Ophthalmology at the Georgetown Public Hospital, and he's advisor at the Ministry of Health on vision and eye health. And today we're going to be talking about eye health matters, but most importantly, we wrap up with talking about the eye testing and spectacle program, which was launched in June of this year. Dr. Sugrim, welcome to our program.
Good morning, thank you.
Walk us through. We'll start with the young people because the program looks at 18 and below and 65 and over. Let's look at the 18s and below, and especially young children. What are going to be some of the common issues that would affect the eye health and eye care for children?
Primarily in kids and in children, the commonest eye condition that we encounter are refractive errors. Mm-hmm. Refractive errors points to conditions where patients may have difficulty in visualizing objects within their environment. In order for us to focus and see things clearly, we need the two main parts of the eye that assist us to do that, the lens and also the cornea. In refractive errors, a lot of the issues has to do with the size of the eye. The commonest one that we find in children is myopia, and this is becoming more of a prevalent problem in children because of them being on near devices such as laptops, iPads, and they're also intensely involved in doing activities on their devices. So this can lead to increased incidence of myopia or short-sightedness. That's where they will see objects closer better than objects in the distance. You also have astigmatism that's common in kids, and also hyperopia. Hyperopia is far-sightedness, where they see things better in the distance than near. Astigmatism has to do with primarily the shape of the cornea. It's not spherical or round as it should be. It's more like egg-shaped or irregular. And all of these conditions we treat with spectacles. And that's why this program that the government of Guyana is implementing is practical in the sense that we want our kids to perform better. We want them to be able to see things clearly. Especially because those children at the back of the class, if you're telling me about long-sightedness and so forth, they will have difficulties in seeing on that blackboard. Exactly, and so those are some of the signs and symptoms that we have to look for. The parents has to be aware of complaints that the child will be having at school, like, okay, I'm not seeing well on the blackboard, or if they see the children are getting headaches, watering, and they complain. And you see also performance with regards to school if you find that they're not performing well. And teachers also can become a part of this process in detecting these problems. So you have to observe the kids, see how they're performing in class, and then from these they can recommend. We have the school eye health program. Overall, it's a school child health program which involves the eye testing component. So this here we can easily pick up these conditions early. And as I had said in an earlier program, that if we do not correct these refractive errors for the children, they can develop what we call amblyopia or lazy eye, which is a permanent blunting or blurred vision in one eye, usually on one eye for the rest of their life, and they may not have their 20/20 vision in that case. So correcting these conditions early on in life will help them prepare for adulthood and lead productive lives. And we don't want to have a society where we have underperforming adults. We want them to perform to the maximum. And that's why eye health and eye care is important on the agenda for the ministry. I want us to go back to that
children and those in device. And recently in Rehab Week, one rehab personnel was talking. Those devices, would make children have difficulty in starting to speak, as the case may be. How, and I don't want to use the word dangerous, but how critical it is that we should not really, at a very young age, and we're seeing almost toddlers, 6 months and so forth, just to distract them, parents are giving them the cell phone and so forth. Is that right, and how do we moderate such a distraction?
In this age of the advent of these devices, like you're saying, it helps to keep the kids occupied, and also helps in terms of their intelligence, and they learn faster. We'll find that the kids are picking up these devices and they're becoming better than the adults, which is good in terms of intelligence level, but when it goes overboard. So we find that the prevalence of myopia is increasing a lot in the Asian countries, and it's also spreading to the Western countries here because of these devices. And when they're concentrating more and more on these near devices, the eye kind of adapts to that, and they become more and more myopic. And if this continues, it will become like an epidemic. And we have been trying to figure out, to understand better why it occurs. And some of the recommendations that are coming in now from research is that if you've noticed that these kids are spending a lot of time indoors, are not spending time outdoors. We find that the effects of the being outdoor with the sunlight helps the eye to develop, so the exposure to sun. So basically what that comes to is for us to cut down the time that they're spending on devices. So it should be monitored. It shouldn't go overboard. Everything should be done in moderation, and they should take breaks in between. Even for the teenagers and an adult coming towards adulthood, spending a lot of time on the devices, coming up with a new condition that we call computer vision syndromes, where it causes them to have tiredness, burning to the eyes, unable to work productively. So there's the 2020 rule that is being promoted within the eye community, that you take breaks, make sure that every 20 minutes you take a 20-second break away, and make sure you also follow the guidelines in terms of having the positioning of your computer, where and how the brightness of the lights, because there's more and more studies showing that the blue light that is being emitted from these devices cause more harmful effects to the eyes. So they are like blue blocking light spectacles and glasses that are being promoted on the market now to help to counteract those effects. And we find also that exposure to blue light from these devices also affects your sleep cycle, and you don't fall asleep, and you lose sleep, and you're not getting your full quota of 7 to 8 hours. And that also as a whole, we can get into a whole lot of issues in terms of lack of sleep. It affects your stress level, your cortisol levels, and that gives you other conditions like hypertension, cardiac problems, and stress causes problems throughout the body. So in terms of regulating activities for kids, we need to do this in moderation. And there's a lot of information available. Parents can read and search on the internet, and there's a lot of advice on how to deal with the kids with the devices.
Okay. This is Health Matters. We're talking about eye care, and especially the eye testing and spectacle program, which was launched recently by the Ministry of Health. Stay with us. We'll be right back.
My name is Natasha Harvey-San, and as an optometrist, I am thrilled about the government's vision screening and spectacles program. This initiative offers a unique opportunity for senior citizens to receive comprehensive eye examinations and glasses without financial worries. This program not only helps us to detect eye diseases among seniors, but also provides prescription lenses to those in need with the aim of reducing eye strain. Don't hesitate, come out and have your eyes tested today.
a great initiative because it does a lot for us as citizens. I know, as the minister said, he's doing this nationwide, and a lot of people can't really, expect to afford spectacles. So a lot of children are suffering, and those in the interior regions, which I'm glad he said he'd announce it too, those are the ones that suffer the most. And due to the expense of traveling out into the capital, etc., it's very costly. So it's great that they're rolling out this initiative in the interior regions, and I myself am going to benefit from this. I'd say if you know that your eyes are giving you a sort of trouble, I'd suggest you still visit an ophthalmologist, because I mean, as students now, you have to do SBAs, and most of the SBAs are done by a soft copy. That means spending hours in front of a computer. Then you gotta re-edit when your teacher doesn't like it or doesn't approve of it. You gotta re-edit this. Then it's more hours in front of a computer, and then these things can really take a toll on people's eyes. And so I'd suggest that if you know you're having a chronic headache, it doesn't mean that it's just a Panadol and it'll go away. Still try to visit an ophthalmologist. These headaches are getting bothersome.
Welcome back to our program. We're speaking with Dr. Shailendra Sugrim. We're talking about eye care. He is head of the department of ophthalmology at the Georgetown Public Hospital. And of course, he's an advisor to the Ministry of Health as it relates to vision and eye health. So Doc, before the break, we were talking about eye care and issues relating to the eyes with children, the adults, because the program targets 65 and over, but a lot of the issues will start long before people reach age 65. What are going to be some of the common issues with persons who are reaching that mature age?
In adulthood, the commonest eye condition that we encounter is cataracts. And cataract has to do with the lens in our eyes. As we age, the lens also ages, and the ability, as I said earlier, the lens is important, plays an important part for us to focus and see things clearly. And as it gets tougher, it gets harder, we call that sclerosis, nuclear sclerosis. We have that inability to focus, especially on objects near to us. And to correct this problem, during the early part of adulthood, like from 40 to 50, most of us will use reading glasses. So we can function, we can sign, we can use a cell phone, we can read our newspapers, and that's also called presbyopia. So later on, as we age, the lens becomes so tough that spectacles can't assist us in reading near, and that's when you have to do your cataract surgery. Apart from cataract and presbyopia in adults, we also have some other common conditions such as glaucoma, diabetic retinopathy for the diabetics. We have age-related macular degeneration, which is not so common in our population, but diabetic retinopathy is becoming an issue for us because it can lead to permanent blindness. Now, most patients after cataract surgery, their vision has improved a lot and they can move around, they can do lots of things, but they will still need a spectacle for your near vision. We have newer lenses that we can use now to help with near and far distance, but we have not been able to introduce that in our society as yet. So those conditions, once you have screening done through this program, once the adults, they come and we screen them, we will be able to pick up these common conditions and assist them in having their treatment as necessary.
We'll come back to talk a bit about some of those issues, but I just want to jump ahead and talk about young adults who want to be fashionable, and then they just pick up these store brands or cheap brand of sunshades because it's stylish, fashionable, and these days now they have all sorts. How challenging is that, wearing all of these sunshades, and will it have an impact when they reach senior adult life?
Not particularly. Actually, we kind of advocate for us, the general population, to wear protective sunglasses to protect from the harmful rays of the ultraviolet rays of the sunlight. And that can help prevent a lot of problems. It can also slow the progression of cataracts. And it helps to protect the retina, the sensitive part of the eye, and prevent degeneration. Also, it also helps to prevent pterygium or pinguecula. These are the degenerative lesions that grow on the conjunctiva, and commonly we say it's the flesh growing in the eye. So we do advise the protective sunglasses. So I mean, having it in a fashionable way helps to promote eye health in the terms of protection of the eye. So usually I'm not adverse to telling patients to continue using their sunglasses, and we kind of encourage it.
Especially when, you know, we're in an environment, especially along the coastline of development and construction, you're having debris and sands and so forth. These temporary eyeglasses or sunshades come in handy.
Another thing that we also recommend is for like construction workers and persons who work in this sort of environment to wear your goggles and these. And then also, when you're doing your sunglasses or your goggles, you can have your prescription within that spectacle or sunglasses. That helps you to perform better and gives you more protection.
Other than the cataract surgery, what are going to be some of the other surgeries you would find in Guyana for the eye?
Apart from cataract surgery, we do a lot of pterygium surgery. We also do procedures such as laser photocoagulation to assist in patients with diabetes. We also do glaucoma surgeries. When the diabetes becomes out of control and the vision in the eye becomes further affected, we need to have retina surgery, and we're now working at the public hospital to introduce the surgery. And previously we didn't have it available in Guyana. Most patients would have to go overseas. So we're working towards having this service now in Guyana.
We got a spectacle, so you know we go through the system. We've got a spectacle, but you know you hear that sometimes the prescription or whatever you have to come back in 2 years, and the possibility of changing spectacles in 2 years. Tell us a bit about that.
So that has to deal with the presbyopia I was mentioning earlier, with the lens changing shape and also the texture of the lens with time as it hardens. So every 2 years we find that the prescription, which we measure in diopters, has to increase. So that's why we need to have those checked every 2 years to increase as needed.
And so therefore, Dr. Sugrim, eye care should not necessarily be if you're having difficulties with your eyes as you reach a certain age. That should be almost part of your medical.
Exactly, and that's why with the school health program, we're having all the kids having their mandatory testing in nursery and primary, and also in high school. And then after adulthood, you should at least test your eyes at least at the age of 40 to see if anything going forward. And then if you have other risk factors for developing eye conditions, like a family history of glaucoma, if you're diabetic, you should have those checked once a year.
Interestingly, you talk about family history. Just of glaucoma, is there any other family history that will be noted for eye challenges of the eyes?
Yes, well, family history of diabetes, hypertension, and also family history of wearing spectacles also.
Tell me a bit about the high blood pressure and eye care.
What we find now with patients who are hypertensive, and usually when we deal with our patients, we know that they may also have diabetes. So patients specifically for hypertension, we find that they have, commonly in Guyana, we have what you have called stroke. So that's a cerebrovascular accident in the brain. So similar condition can occur in the eye, a stroke of the eye. It's actually an occlusion of the blood vessel in the eye, and this can lead to blindness. So that's the commonest condition that we find in the hypertensive. So that's why we always advocate to the patient to keep their blood pressure controlled. Also, if you have concurrently diabetes and cholesterol levels elevated, that can also contribute towards a stroke. So that's an important condition that we talk to patients about in terms of managing their hypertension.
Let's go back a bit to the children, and let's say those that will have challenging issues with the eyes. How does that affect them as they reach that age 60 or 65?
It becomes like a socio-economic issue in terms if you don't have a good vision, then you can't perform well in society, and that will augur well in terms of the national development. You need to have kids who are seeing well so that they can perform.
So that's why we're starting in school.
Yes, exactly. So that we can have a better society, an overall productive environment. We have healthy working adults.
Okay. Dr. Shailendra Sugrim, thanks a lot for being on our program to talk about eye care as it relates to young children and the older adults, as the Ministry of Health is rolling out its eye testing and spectacle program. After the break, we'll find out more. We'll have more details as to the program. Don't go away.
The Ministry of Health has launched its eye testing and spectacles program. This initiative caters for anyone under 18 years of age and persons 65 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at any of the opticals listed at the back of the voucher. If a patient requires spectacles, he or she can then uplift another voucher valued at $15,000 to cover the cost of the eyewear. Vouchers are available at various hospitals and health centers in your region. To learn more about this program, call 227-4357 or visit the Ministry of Health's Facebook page. Your eye health is important, so why wait? Get your eyes tested today. Your sight, our vision.
Welcome back to our program. I've got with me Prea Chunilall. She is from the Medical Treatment Department at the Ministry of Health. And we're going to be getting some details as it relates how the program will be going, how the program, you can access treatment, this eye screening and spectacle. Prea, welcome to the program.
Thank you.
Tell us, who's eligible for this eye testing and spectacle program?
Okay, so this initiative caters for persons who are under the age of 18 years old and persons who are 65 years and older, basically our pensioners.
All right, good. So, where can those persons, let's say mothers or fathers for the children and the pensioners, 65 and over, where they can uplift their eye testing voucher, which is valued $2,000?
Okay, so the eye testing voucher is available at various health centers nationwide. Those vouchers can be picked up there. You can also visit the Ministry of Health Facebook page to see a list of those health centers which may be closer to you. Or you can also call our Ministry of Health phone number 227-4357 to get more info on that.
All right. And so some of those places where they could go can be found at the back of the voucher, plus the places are also available on the ministry's Facebook page.
Yes, that's for the approved eye care providers.
All right. So where can I pick up the vouchers? You know, let's say I'm living in Region 3.
Okay, so in Region 3 we have various health centers. So if, for example, we have like the La Grange Health Center, we have like the Lenora Cottage Hospital, the West End Rural Regional Hospital. And the Prea Health Center also.
Right, and of course, there are going to be those listed on the Facebook page, and I'm quite sure
Yes.
it's going to be between the regular working hours.
Okay, so these vouchers can be picked up between the hours of 8:30 a.m., 3:30 p.m., Monday to Friday,
Right.
during the week.
Excellent. And so what, let's say, you know, I'm a father. I just go into that listed, you know, healthcare center, and I just ask for the spectacle voucher.
Okay, so if you're going to ask for the spectacle voucher, that means that...
No, sorry, the eye testing voucher.
Well, okay, so you go if the child does not have an ID card, you take their birth certificate just to prove the child's age to the person issuing the eye test voucher.
Excellent. And how long will this distribution last for the eye testing?
Well, the distribution process is going to be lasting until the remainder of the year. It's running throughout the year.
Right. And of course, you know, we did talk about where, you know, who are the approved eye care providers, and you know, we can just go back again. It's listed at the back of
the vouchers.
Vouchers.
And you can also visit the Ministry of Health Facebook page.
Right. So what happens now if I go, you know, I'm 65 years and older, and I go and I collected my $2,000. I go to the testing site, and they tell me I need a spectacle. What happens?
Okay, so when you get your eyes tested with that $2,000 voucher, you would get a prescription once you need a spectacle from the eye care provider. You take that prescription to your closest health center, and they would issue you a spectacle voucher, which would assist with the cost of the eyewear.
So basically, it's the same healthcare center you would have received the eye testing voucher for $2,000. You take it back to that same health center.
You can, or you can take one closest to you. It's up to the patient.
Right. And just to make it clear, this $15,000 doesn't, you're not going to get a spectacle for $15,000, right?
Well, if the spectacle is under the cost of $15,000, that would assist with that cost. But let's say, for instance, the spectacles or the eyewear cost $20,000. The spectacle voucher covers $15,000 of that cost.
Now, here's an interesting question. So you'll have persons out there who are 65 years and older, and they would have contributed to NIS. And the National Insurance Scheme also provides a spectacle voucher, but this time it's only every 2 years. And currently, they're providing a voucher to the tune of $12,000. Can I, as someone who is 65 years and over, get, of course, I mean, you will get that voucher from NIS. Can I also access, if I need a spectacle, access that $15,000 voucher also?
Yes, you can. You can. We have some of our eye care providers on board with us that are accepting both the NIS and the Ministry of Health, the Government of Guyana, sorry, eye care vouchers.
All right. So that should be good news for those of you out there who are beneficiaries of the National Insurance Scheme, and so you can couple your NIS voucher for $12,000 with the Ministry of Health, Government of Guyana's voucher for $15,000, and that will help to bring down the cost of your spectacle. Another important question people might want to ask, can persons between the ages of 18 and 64 utilize the voucher?
At this time, no. It just caters for persons under 18 years old and persons 65 years and over.
Absolutely. Now, another question people might want to ask, you know, can I exchange a voucher for cash?
Oh, no, no. If these vouchers are being encashed for cash, it can result in severe penalties, including jail time.
All right. So, quickly, as we wrap up, where can we get the vouchers?
The vouchers are available at health centers nationwide.
And of course, we look at the Ministry of Health's Facebook page, and they will tell us exactly where those health centers are. And if you turn up, I guess if they turn up at a health center that doesn't have the vouchers, that health center will refer them to another health center, as the case may be. Well, thanks a lot for being on our program.
Thank you.
This has been Health Matters. On today's program, we spoke with Dr. Shailendra Sugrim, and we spoke about challenges and issues relating to eye care as it relates to children and adults, especially those older adults. Of course, we spoke to Ms. Prea Chunilall as it relates to how you can access the vouchers, $2,000 for the eye testing, and once you've got a prescription for glasses, how you can also obtain that voucher for $15,000. All these informations are available on the Ministry of Health's Facebook page. Thanks for watching. My name is Nazim Hussain. Do join us again next time. And until that time, stay safe.